So, can medication indirectly make your mental health worse? From my personal experience and research, I think the answer is absolutely yes. So, I know some guys are going to attack me in the comments. They're going to say I'm anti science, anti medication. So, let me just say I think medication can be necessary in certain circumstances for the right person. But what I'm trying to say is that we have to take a long term and overall view of our health so that we can understand how to actually treat mental illness and identify the root causes. Because it is scientifically proven that some things like nutrition, exercise, sleep quality, all of these things can actually improve your mental health more than the medications. So, in that case, the medication does not become necessary long term. The other thing I have to point out is that these medications, antidepressants, antipsychotics, they have very severe side effects, and it's usually dose dependent. The higher the dose, the more severe the side effects are. Now, the problem with that is if you go to a psychiatrist and you're started on medication and you don't see any improvement, their natural response is going to be to increase the medication. They will continue increasing the dose because they see that as basically the most effective way to treat your mental illness. Now, sometimes this works, sometimes it doesn't. Sometimes people just don't respond to the medication. On the flip side of that, all these medications, all psychotropic medications that are used to treat mental illness, have very severe side effects. If you ask anybody that's been on antidepressants or antipsychotics, pretty much all of them will tell you they've experienced things like being tired all the time, losing their motivation, their discipline, their will to be productive. These are just sort of seen as a necessary price to pay. They say, yes, you're going to have these side effects, but it's also going to treat your depression or your anxiety or whatever illness you have. So it's basically just a price you have to pay. So my question is, if it's treating one illness, but it's causing other illnesses, is that really the best long-term approach to treat somebody and to bring them to mental health? I personally don't think so. So I think if somebody's taking all the preventative approaches and they're taking care of their lifestyle and health factors and they're treating the root cause of their illness, oftentimes with holistic healing methods, they can reduce or come off of the medications completely. And the real reason I say this is because, again, indirectly, these medications with their side effects can worsen your mental health. For one example, if you're taking antidepressants and they make you tired all the time and you sleep too much, that is a known factor to make you more depressed. So it's all these sort of side effects from the medications. You know, if you're sleeping too much, if you have no motivation, you can't perform, you can't be productive, you're sort of just losing your personality, you're losing all these things just as sort of a price you have to pay to maybe treat your depression or your anxiety or whatever illness you have. So long term, I just don't think it's the best approach. And I think that we're doing people a disservice by telling them that they have to stay on these medications at high doses pretty much for the rest of their lives, as if that's the only treatment method that actually works.